I'm Dr. Sara Haidar. I'm a pediatric hospitalist at Children's Hospital of Michigan, Detroit. We used to feel very happy that kids are getting lucky, they're not catching the virus, but in the last few months and few weeks especially, we've seen a tremendous increase in the number of patients testing positive for COVID and actually getting hospitalized because of COVID complications and different diagnoses. So most commonly when kids are admitted to the hospital, just like any cold virus, it can trigger, difficulty in breathing, croup, bronchiolitis, asthma, and pneumonia. Some kids get kind of stomach bug type of symptoms like vomiting, diarrhea, nausea, and they come in dehydrated and they need IV fluids and lab draws. Rarely we are seeing kind of worst case scenario myocarditis, which is inflammation of the heart muscles, and MISC, which is a condition that causes multi-organ inflammation and damage and can cause heart failure and even death. So these really sick kids are requiring life support and intensive care unit monitoring. Some kids are there for a few days, some kids are there for a few weeks. So I'm kind of seeing the kids that are most affected by COVID-19 are getting most sick from it. And some kids are even newborns, a few days old, and they're coming in with fever and these symptoms as well. Luckily, the extremely life-threatening conditions are rare. So it's not likely that a child will come in with these complications or will suffer these life-threatening conditions. Actually, because kids account for about 20% of total positive cases, more and more of them are getting sick just because of the sheer number of kids that are catching COVID. In general, MISC is relatively rare, and most kids have mild or no symptoms at all. So I am seeing kind of the worst case scenario. Yes, vaccines are definitely very protective. Data as new as last week show that these rare complications like MISC are virtually only present in kids who are unvaccinated. Over 91% of kids with MISC are unvaccinated. So kids who have acquired the vaccine hardly ever get these complications. So just like we have seen in adults that the vaccine is preventative and protective against these serious illnesses from COVID and complications, it's the same in children. The vaccine is protective, and it's the only way to ensure good outcome if a kid catches COVID. I think you're talking about myocarditis. Myocarditis is inflammation in the heart muscle, and it has been documented in less than 1 in 10,000 children, especially in the 12 to 17-year-old age group, who receive the vaccine. Usually what we know about it is that it happens a few days after getting the vaccine, and it's extremely rare. It is actually much more likely that you develop myocarditis from the virus itself than the vaccine. And even if you get myocarditis from the vaccine, most of the time the symptoms resolve on their own and you don't even need any treatment. But because we're keeping track of every side effect, it is important to know that if your child is a teenager and gets the vaccine, learn that what symptoms you can expect to see with myocarditis or what to watch out for, such as chest pain, fast heart, and so on. So we take extreme precautions whenever a new vaccine is released, both with adults as well as kids. Because children are of different ages and different sizes, there's a different dose that could be effective depending on the child's age and size. So it's very important for vaccine trials to take one step at a time, and that's why we have to enroll children kind of gradually in different vaccines trial to determine the most effective and safe dose. So what we know so far is that the Pfizer vaccine has been approved for kids as young as 5 years old. It's been shown to be effective, and we talked a little bit about the rare side effects of the vaccine, but most kids do extremely well with very mild side effects like soreness at the injection site, as well as maybe a low-grade fever, some body aches, and usually these side effects are very short-lived and very tolerable. And so kids are doing extremely well. The Pfizer vaccine is the only one that's been approved so far. Certainly there are a lot of other companies that are working towards getting approval, but this is the one that's been shown to be safe and effective with minimal side effects. And of course, there's ongoing trials for the younger age group, infants to 5 years old. And we have to make sure that we give these children a safe and effective dose. So we take it very seriously. So we know that the COVID pandemic and the virus itself is constantly changing. And because of that, it's important for us to be prepared. We have data that's up to date right now, and we don't know what this virus is going to do in the future. I recommend the vaccine for everyone and kids at least 5 years or older, because we know that it's protective right now, and we don't know if the next strain is going to be more serious, and it might affect kids more than adults. So it's important to not take any risks in this case. Because the numbers are increasing so much and kids are at such higher risk for contracting the virus and getting hospitalized now more than ever, it's important to get the vaccine now and not take the risks. If you wait, even though it's rare for a child to die from COVID or get complications from COVID-19, you are taking that risk. And many children have no significant medical history to help us determine who's at risk for having these complications and who is not. A lot of kids are healthy without any comorbid conditions. So it's hard to determine which child is going to get sick and which child is not. So I do recommend the vaccine for everyone. So in children, luckily, we are very fortunate that they're not getting affected like adults are. So, less than 0.1% of children actually die from COVID-19. However, if you look at the just pure numbers, we've had over 1,000 pediatric deaths from COVID-19 that are easily preventable with just a vaccine. And more than 160,000 children have lost a parent or a primary caregiver to COVID-19. So even if kids are not directly getting affected as bad as adults, because they're losing a loved one, a family member, they're losing a parent, and that's a huge deal. So we do need to start talking about kids more. So when children get sick with COVID, they can have other rare complications. The CDC is actually following up on new data suggesting chronic medical conditions like diabetes can result after COVID infection. There's new data to suggest that encephalitis and brain inflammation can also be caused by COVID in children. So these are things that we don't see with other cold viruses. And when people say it's just like the flu and it's just a cold, for some it might be, but kids might have no symptoms at all with COVID and then subsequently have really adverse outcomes and chronic conditions because of it. And sometimes the link is not made because a child might have COVID without any symptoms. And we only detect, we only find out that they have COVID later on if we check their antibodies, let's say, if we're actually looking for it. So this is kind of the mysterious part about COVID, and the part that causes kind of unexpected outcomes when you don't even know you've had the virus itself. There's something called long haul COVID, which again, it happens in school-age kids, even in adults. They get COVID, they recover, supposedly without any complications. It feels like a regular cold, or they don't have any symptoms. And then days and weeks later, they have memory deficits, they have attention problems, aches and pains that affect their performance at school. If they're participating in competitive sports, it can affect their performance there too. So you just don't know what effect it's going to have. And I would say, you have a vaccine, you have a solution, why not take it? You know, even before the pandemic, we've had kind of a separate pandemic altogether, which is mistrust in medical information and the medical community in general. Of course, mistrust of government agencies. It actually goes way back. There have been events throughout history where bad things happen. But I would say in this case, this specific technology, the mRNA vaccine itself, whether it's from Pfizer or Moderna or anywhere else, it's been studied for decades, even before this COVID vaccine came up. So even though Pfizer is probably making lots of money from producing the vaccine, the information that the community is receiving and the general public is receiving, if they look at medical guidance and guidelines from the CDC and from their physicians and doctors and actual data, I would say this is where the information is most trustworthy. The fact that the vaccine rollout was really fast is a huge breakthrough in medicine, and something that the medical community is proud of, and something that's going to go in the history books as a huge success. The fact that researchers collaborated in order to get the vaccine out this quickly. I mean, imagine we didn't have a vaccine up to this point, 2 years into the pandemic. I think the results would have been even more catastrophic than what we've seen now. The good news is we have a solution to this pandemic. The vaccine is the key to ending the pandemic. Over 8 million children, especially in the 5 to 11 age group, have already gotten their vaccine. That is a huge number. So many kids have gotten their shots, but a lot of people are still hesitant. You should trust that these 8 million kids are in a much better place now and more prepared to handle a COVID infection. Even though 8 million seems like a large number, it actually only accounts for about 15% of kids in that age group. So what are you waiting for? The COVID vaccine is so easily available, probably at your local pharmacy. It is safe and it's effective. I got my 5-year-old vaccinated, and I can't wait to vaccinate my 3-year-old as well. I know it's easy to feel hopeless and helpless because this pandemic is ongoing without an end in sight. But I want you to know that we are here for you. Your pediatricians, your doctors, C-Asist, and a lot of helpful organizations are there for you to make the most informed decision for yourself, your family, and for your children. I'm a pediatrician, I'm a mother of 2, I'm pregnant, and I'm from your community. And I got my vaccine, I had my entire family vaccinated, and I feel prepared that I'm going to stay healthy so that I can be present for my children, and you can be too. So make the right choice and go get your shot.